Hello, I'm Britt Carlson for Oroville Hospital, and today I'm joined by Dr. Osahon Osifo, and you're with the anesthesiology department.
That's correct.
First of all, tell us a little bit about yourself, just how long you've been a doctor, how long you've been at Oroville Hospital.
I finished med school in 1995, Loma Linda, and then I did general surgery training. After general surgery, I did anesthesia training. And then I did a fellowship in cardiac and critical care for adults and pediatrics. And I worked in Palm Springs for about 8 years as a director of the Cardiac Institute there. And I've been here at Oroville Hospital now for almost 8 years.
All right. So what was it that drew you towards anesthesiology?
Well, I like the cerebral thinking. I like being able to take away patients' pain. I like being able to help patients from beginning to end, the whole person care, not just focus on one part, but take care of the whole total package.
And that's something that we spoke about earlier is anesthesiology. We think, okay, it's just going in, putting a person down for surgery, and that's it. But really, you're with them for the duration of their stay. So
That's
explain
correct.
that process a little bit.
Sure. Anesthesia, we do perioperative care. So once the patient and the surgeon decide they're going to have surgery, they come and see us probably a week or two before the surgery. And we have a group of anesthesia providers that see the patient, to do a history and physical on them, and we find out what's wrong with them. If there's a heart problem, we send them to a heart specialist. If there's a lung problem, we take care of it, or we send them to a lung specialist. So somebody comes in just for a gallbladder. By the time they leave us, we'd have taken care of anything else that might be wrong with them and make sure they're healthy before surgery. And then we do take them into the operating room and we put them to sleep or design an anesthesia plan just for them. Mm-hmm. So every anesthesia is different based on the age, the male or female, what kind of disease they have. And we come up with a specific pattern just for the patient, specific drugs just for the patient. And we want to make sure they're pain-free afterwards as well. So we take care of them in the recovery room for at least an hour, sometimes up to 2 hours, and make sure they're comfortable, they're pain-free before we send them home.
Exactly. And patients can be a little hesitant about anesthesia sometimes, just being put under. So how do you make them feel comfortable about it? Obviously, having a detailed plan specifically catered to them, I think would help. But are there any other things you do to kind of help a patient before they do that?
Yes, there is. Sometimes the fear of anesthesia is worse than the fear of the surgery itself. So our goal is to make these patients as comfortable as possible. We explain to them what we're going to be doing, and we also have medications that we help to relax the patient. So some patients are quite anxious and do request the medication. Even if they don't, we suggest that they get some Versed, some equivalent of Valium or Ativan, and it helps relax them before surgery. And just letting them know what's happening, keep communication usually helps quite a bit as well.
And what do you enjoy about just your day-to-day tasks and your daily job?
I enjoy my interaction with patients. I enjoy taking care of patients. I enjoy seeing them from the beginning to the end and seeing how happy and how grateful they are for what you've done and being a part of their life. I really enjoy that.
And if patients or their families do have any questions about the anesthesia or, in preparation for a surgery, how would they contact your department?
There's two ways they can reach us. They can check the website, orovillehouse.com, and they can click on the anesthesia link and send me any questions, and I'll always answer that. Another way is to call the hospital, ask for Dr. Osifo, and if I'm taking care of a patient, leave a message, and I will always get back to them as well.
Great. Well, thank you for all the information and joining us today, Dr. Osifo.
Thank you.
You're welcome.